Good evening, everybody. Welcome to another episode of Uncommon Sense with Jose Negron. Now, for the benefit of those of you who are not familiar with the channel or are watching this channel for the first time, the reason why it is called Uncommon Sense because here on this platform, we deal with everyday issues and we try to come up with logical solutions. But not everyone uses logic. So, for that reason, it is called Uncommon Sense. I want to let everybody know that I'm currently live on YouTube, Facebook, Twitter, and Twitch. I also need to let everybody know that the subscriber mode has been enabled. What does that mean? That means that if you are not a subscriber and if you wish to enter a comment in the chat, you need to subscribe to the channel. So, as always, I want to give a huge shout out to all those that were already subscribed to the channel, whether it be from day one or just recently. I appreciate all the love and support all of you have given me. I also want to give a huge shout out to all those who follow me on social media. And I also want to give a huge shout out for all those who allow me to enter into your devices. So, what I'm going to ask you to do is the following. If you have not done so, I'm going to ask you to please subscribe, like, and hit the bell notification to all. So, therefore, whenever I do produce content, you will have the opportunity to catch it live or catch it on playback. I also want to let everybody know that tonight's stream and the following stream, which will be on Thursday night, um, anyone, if they wish, they can share the stream because what I'm going to be doing is I'm going to be sharing some useful information, particularly those information for all those who are thinking about getting um, joint replacement surgery. Okay, so that's the reason why anyone can share it, and I'm not going to share the disclaimer tonight should anyone join the panel. All I ask is to make sure everyone respects everyone's freedom of speech and make sure that only one person speak at a time. So that being said, I'm going to have another session of In My Words. I'm happy to say that so far in these YouTube streets have been relatively quiet. There's not been a lot of drama going on, which is a good thing. In my own personal life, um, I took some time. I was away for a couple of days in the city, just a time for time reflection and a time to rest up, to prepare for the things I'm going to need to do. And I would encourage anyone, if you have not done so, try to take some time off to get away or have a stay vacation. In other words, devote some time to yourself so you can tend to yourself and tend to your personal needs. Now, yesterday I actually had went to have a CAT scan done in regards to my needs. So hopefully, my doctor will contact me in a couple of days to give um, his analysis in regards to the condition of my knee. For the benefit of those of you who are not who do not know my situation, I've been dealing with a lot of quite a bit of pain in my left knee, which led me to have to walk with the aid of a cane. And I've seen the doctor, and the assessment was that I'm gonna need um, revised knee replacement surgery. So I decided since I'm going to be expanding all this, I'm going to share with you, the audience, in the form of a blog, all the things that are happening, with the goal that should you know anyone that's undergoing or in the process of going through total knee replacement, um, they might be encouraged with what I have to say. Okay. Of course, it's a nervous time. It's always a nervous time whenever anyone undergoes major procedure. Okay. But the key is to remain calm. The key is to learn as much as you can regarding the operation itself and make sure that you do everything possible to ensure that you have the best possibility for a recovery. Okay. Which is, this should be the goal of every one of us. Okay. Now, with that being said, we're going to get into the main topic. So, as you can see in the thumbnail, the title of the thing is My Knee Replacement Surgery. So, what I'm going to be relaying to the audience, what I have to undergo first to have a total knee replacement for my left knee and a total knee replacement for my right knee. Now, before we get into the topic, just give me a moment. We will have to I have to discuss the reason why knee replacement surgery is necessary. Okay, so let me just take me a moment. I'm sorry. So basically, the reason why a knee replacement will be responsible because if you're suffering from arthritis, okay. Now, what is arthritis? And I see here we have Keisha. Good evening. Thank you very much for stopping by. Let me just define what is arthritis. Arthritis is an inflammation of one or more joints causing pain and stiffness that can worsen with age. Different types of arthritis exist with different causes, including wear and tear, infection, and lung diseases. Now, with a healthy knee, there's cartilage, and what that does, it acts as a cushion between the different parts of the knee. So what happens when you have arthritis? What happens is that cartilage becomes weaker, and eventually it becomes worn when it's a situation where it becomes basically bone on bone. And what happens is that makes walking very painful. That's currently the situation that I'm dealing with, Perry. Now let's define, just give me a moment. Okay. Now a knee replacement, what it is, it is a procedure done where it removes parts of the injured or worn out knee joints. Okay, the surgery can help ease the pain and make the knee look better. So basically, what is done is it's a procedure where that part of the knee is damaged, and what they do is they insert an incision, cut a small hole, and they remove that part of the knee and they place it with an artificial knee. So that's now what I'm going to do is I'm going to share a video to illustrate the point. No, that's not what I want. Okay. Okay, I don't know if, okay, just bear with me, please. Okay, so what I'm going to do is I'm going to show a video regarding how to prepare for a knee replacement. And just make it perfectly clear. I'm citing fair use, fair use, fair use. The whole purpose is to give a critique and just to give an assessment to help illustrate it further. So,
Hi, welcome to Talking with Docs. I'm Dr. Paul Zalzal.
And I'm Dr. Brad Winnie.
And today's episode is concerned with what to do before your total knee replacement. So you've met with your surgeon, you've booked a total knee replacement. We're going to discuss what you have to do to prepare for that.
I think that's a great thing. A lot of people that come to the office, consult happens quickly and they leave in a bit of a tizzy.
Yeah.
So we're going to try to give you some stepwise steps to help be more prepared.
Right. You can, and this is very similar to our video on how to prepare for a total hip replacement, but there are some key differences. First thing I'm going to say is it's okay to be nervous. Everybody is nervous before surgery, and usually they get more and more nervous as the day approaches. That is normal.
Yeah, and by preparing, hopefully we can just reduce some of your anxiety and increase your chance of success.
Right. Okay.
okay. So as you can see here, it's perfectly normal to be concerned regarding a total knee replacement surgery. And in fact, there'll be something wrong with you if you wasn't concerned about it. Okay. However, the whole purpose of this stream and this video is to illustrate that with following instructions, um, educating yourself on what entails will help you prepare for a knee replacement and will get you the most desirable results. So now we can continue fair use.
Okay, so I've got my package here. I've booked my surgery, and generally in your surgeon's office, you're going to get a package that'll instruct you how to arrange a pre-operative visit at the hospital where you're having the surgery done, where you're going to get a ton of information.
So typically there, I know at our hospital, Paul, we have a class where they teach you a bunch of things, what to expect. There's some patients actually that have had knee replacements done to help explain it to you. And then you have some blood work, a chest x-ray, usually potentially a cardiogram, and then you may or may not see the anesthetist to talk about the type of anesthesia that you would get.
Right, and you'll have to see your family doctor before to have sort of a health assessment to make sure that you're as healthy as you can be for the surgery.
And usually either your family doctor or the hospital will tell you when to stop eating and drinking, when to stop your pills. Typically, what do you find they tell you, Paul?
No eating or drinking after midnight the night before surgery. And then the pills, it depends on what pills you're on, what medications you're taking, and for what reason. And those are generally addressed when you go to your pre-op visit. The ones that sort of have the most concern are blood thinners, so that you will come up with a plan on when to stop your blood thinner and if you need an alternate.
Okay. So as you're getting close to the date for surgery, there are going to be certain medication which the doctor is going to advise you to stop taking, okay? Because it can have a negative effect with the medications that you will be receiving. Also, it's very important to remember that after midnight, you're not supposed to eat or drink anything. And actually, the doctors are going to explain further why. So we shall continue. And again, fair use, fair use, fair use.
a blood thinner from the time you stop it until the time you have your surgery.
A lot of people tell me, hey, my surgery's in the afternoon. Why do I have to go so long without eating and drinking? Like, what's the big deal? I'll just have a small breakfast, maybe, have a donut.
Right. Well, you got to have an empty stomach for surgery. And then the anesthetist is really the one who really wants you to have an empty stomach, because if you have a full stomach, you may vomit during the surgery when one of the anesthetics are being administered, and which isn't a huge deal if you vomit, but if you aspirate it or breathe back in some of that, you could end up with a very dangerous pneumonia or lung infection. So it's important to have an empty stomach before you have an anesthetic.
Okay, so we're through the medical side of before the knee replacement. What comes next?
Well, preparing yourself, and well, it's kind of medical. It's modifying your risk factors. Risk factors are things that put you at an increased risk for a bad outcome. And some risk factors are modifiable. So if you can modify a risk factor before surgery, then do so to increase your chance of outcome. So if you're a smoker, you've got to try and quit smoking. If you have obesity, you're carrying extra weight, try weight loss. This will help you get a better outcome.
Another thing that I tell people is manage your medical problems appropriately. So if you have really high blood pressure, talk with your family doctor, get that under control. If you're diabetic, you don't want to be too sweet for surgery.
Yeah.
Like you, Paul. Right. And then the other modifiable, yeah, you're very sweet. The other modifiable risk factor would be the range of motion and strength of your knee. So the stronger you can be and the better your range of motion before a knee replacement, there's good evidence to show that's going to improve your function. So attending an organized physiotherapy program, either at a hospital or at a private clinic, and working on the exercises on your own at home has significant benefits for you as a patient. And as we cut through the muscles to do the knee replacement, if they're stronger before and you know the exercises, it's going to make things easier afterwards.
Right. The biggest risk.
So the doctors are bringing up a very important point, which is the following. If you have other health concerns, like you're smoking, you need to stop that, because what happens is it can limit the healing effect that you need to experience. Okay. Also, the other things you need to control. Make sure that your blood sugar is under control. Make sure that you try to get your knee as physically fit as possible to the extent that you're able. Okay. I'm going to start an interesting case in point. When I had my right knee done, prior to that, I went to the gym and I was able to exercise to the extent I was able. And I have lost about 35 pounds prior to surgery. So as a result, while I had my left knee done, I was out for 3.5 months. When I had my left knee done, I was out for 2.5 months. And one of the keys is the fact of the matter, because my right knee was stronger, and plus I had lost some weight to ease the pressure on my knees. So now we will continue. And again, fair use, fair use, fair use.
Factor for a stiff knee after total knee replacement is a stiff knee before total knee replacement. So get your range of motion as good as you can before you have your knee replacement. So we talked about the package you're going to get from your doctor that's going to hook you up with a preoperative visit to the hospital. We talked about seeing your family doctor. We've talked about modifying any risk factors you can modify, medications that might have to be stopped before, doing some prehab before. What else?
One of my big things is I want people to have a plan for when they're leaving the hospital. So a lot of people say, well, I just want to stay in the hospital till I'm better. Unfortunately, particularly in Canada, as we have a socialized healthcare system, that is not practical. You're going to go home on day 2 or day 3. On a rare occasion, you might get some inpatient physiotherapy, but I need people to know that where are they going to go? So the options being, you might be able to go home. You might go home to live with one of your children. Right. You might potentially go to a convalescent care home, but you need to have a plan.
Yeah. You're not going to be better
Now, what they're talking about is what happens on the day that you discharge. Okay. Now, depending what your condition is going to determine where you go. Many patients will end up being discharged to their homes, or they might end up staying with a loved one or friend for the first few days. Okay. Also, another thing to take into consideration is your home environment. Okay. First of all, does your building or your dwelling where you live, does it have a ramp? Do we have steps, and how many steps? Because mind you, you're going to be walking with the aid of a walker for the first 3 to 4 weeks, possibly longer. So it's very important that you have a plan where you will go. Some people may end up at a rehab center for a few days. It all depends. It's a case by case basis. Another thing that you need to do is that you have to prepare your home to make it as safe as possible, meaning make sure there's no rugs that you can trip, make sure there's no wires, make sure there is no cables on the floor and things of that nature. If you can, if you can have someone help you do your laundry, okay. If you have pets, someone needs to tend to them because you cannot, particularly if you have a dog, because dog, when they see their masters, they get very excitable and they want to jump and get all affectionate. The problem is you can risk a nasty fall and hurt yourselves. So now we will continue. And again, fair use, fair use, fair use.
Bedridden after, and we talk about this a bit in our video about what to expect when you get home from your surgery, but you may need some help for some time, depending on your age and depending on your abilities before your surgery.
Say you are going home, Paul. Do you tell them to do anything to their house?
Well, I think.
What about those lifts for the stairs?
I'd like to have one of those.
Those do look
cool.
Those do look good.
If it could bring up my dinner for me. No, generally, the physiotherapist makes sure before you leave the hospital, you can manage in your home. So if you have stairs, they'll teach you how to do stairs before you go home. So there's not a lot of modifications you have to do in your house for a knee replacement. You should be able to sleep in a regular bed, and you should be able to get yourself around pretty good. But you might just need someone around to help you for a while.
Common question I get is, Doc, my bed is on the second floor.
Right. Well, I wouldn't. Personally, I don't tell people they have to move their bed to the main floor.
Me either.
I think you'll learn how to do stairs before you go home, and the act of going up and down stairs is great physiotherapy for your knee.
Usually I tell people too, you'll probably come down in the morning, and you may go up at night, so you may not be going up and down the stairs. Some people actually will have a walker on the top floor and the bottom floor, but I think you can avoid it if you feel inclined to bring a bed. You certainly could do that. Some people rent special beds. I don't think that that's mandatory.
Not in the majority of cases. So we've covered a lot of stuff to do beforehand. Anything else you can think of that people have to do to prepare themselves before their knee replacement?
I'd say one other thing. I think having a plan for swelling in your leg, I think is critical. I think swelling in a knee replacement is a big problem and a big limiter to your ability to fully straighten, but primarily bend your knee. So some type of icing. So whether that is a bag of peas, a traditional sack type cooler, or a formal cooling unit that certainly have come a long way technologically and can provide significant benefit in that reduction of swelling.
Absolutely. I strongly recommend my total knee replacement patients get some sort of cooling unit, some sort of formal device that is
Now, what the doctors are talking about is this. You're gonna look for the next 8 to 12 weeks. Your job is going to be getting your knee in shape, okay? And later on in the video, the doctors describe this as a marathon. So you will be doing physical therapy every single day. You will be doing exercises every single day. So as a result, your knee whether it be your left knee or your right knee, it's going to be sore like the dickens. Okay. Of course, they're going to give you opioids to ease the pain. Okay. However, one thing you need to do is you're going to need to ice out that knee. So what you do is you get either, you get like an ice bag or something for ice in to ice up that knee to lower the swelling. Okay. Another thing to bear in mind is the following: your knee is going to hurt. Okay, because remind you, um, your knee has been inactive for a short period of time. So therefore, to get the knee active again means you're going to have to move it, and it's going to hurt like heck, which is why they give you pain medication. Now, when I had my left knee done, I was on oxycodone and morphine combined. So we're talking about two strong opioids, okay? And it was a miracle that I did not get addicted to the stuff. And of course, that's a concern that many people have. But the good thing is that your doctor is going to be monitoring your use to make sure that you do not get addicted to opiates, because that is a concern. So now we will continue. Again, fair use, fair use, fair use.
Made to cool your knee after. Generally, it's a pad that goes around your knee and it's hooked up to a reservoir with a pump, and it circulates ice water. And I want people to get that before surgery so they can bring it with them when they come for surgery, and then we can set it up right there.
And they either rent that or buy that,
Yeah,
right? Depending on
yeah,
the type of plan.
Exactly. Now, what about things that might happen that could happen before surgery that may require the surgery to be canceled?
So I would say the number one reason procedures get canceled in the last 10 years for me would be some type of medical issue. So they're seen early in the morning and the anesthetist finds something in some of the investigations that is not quite right and that they feel could be optimized. And because a knee replacement is an elective procedure, it does not have to be done emergently, that it can be delayed if they're better. That's probably the number one reason. But the other one that I worry about is an infection locally. So if I have to cut through tissue that doesn't look good, which is probably the exact reason that we tell people, please don't shave your knee, because shaving has a subtle increase of either you making a cut in the skin or potentially getting an infection.
Yeah, don't shave your knee right before surgery. So, and if this does happen to you, if your surgery does get canceled for some reason, some medical reason, it's very upsetting. Everyone's upset, and you have every right to be upset. But try and remember that the reason that it gets canceled is to make sure that you have the best possible chance for a good outcome without any complications.
Just quickly, Paul, if I've
Now, another point that the doctors raise is that whatever you do, people, do not shave the area on the left knee that's going to be operated on, okay? Because if you do, you can risk an infection, okay? If they discover an infection, they may postpone the procedure. That's no fun, okay? Considering that you have prepared yourself mentally and what have you for the procedure, only to find out that it's been postponed because of an infection, whatever. The best thing you can do is make sure that you follow the doctor's advice regarding preparation for the procedure itself. Okay. And again, the doctor, they will orientate you regarding which medication to not take. They're going to give you medication that you're going to need. You're definitely going to take blood thinners, okay, to make sure that, to protect you and make sure that everything is okay. Okay. Also, there's an issue regarding constipation, because you're taking all this medication, which might make you irregular. So they will give you medication to deal with that. So now we will continue. Again, fair use, fair use, fair use.
have a cold, should I just not show up for my surgery?
Just come. If you have a cold, come to the surgery. The surgeon, you, and the anesthetist will all decide together if the surgery should go on or not go on.
Great. Sounds good. I'm ready.
All right. So good luck. It's normal to be nervous, but hopefully this helps you, now that you know some of the things you have to do before your surgery, helps you calm down before surgery.
If you have further topics that you'd like us to discuss or specific questions about this, feel free to email us at talkingwithdoc.
Okay, I apologize. This is the first time I'm able to screen without a massive delay. But here, okay, so I'm sorry. This is my train of thought. It's very important that you be as healthy as possible. If you do develop a cold, depending on how serious, how the cold is, it can delay the procedure. The bottom line is do what you can to follow the procedures to get the best result possible. Now I'm going to stop sharing. Okay. So now what I'm going to do is I'm going to give you my experience because I happen to have both my left knee done and my right knee done. Okay. So it was very similar to what the doctors discussed. Okay. First of all, I had the initial appointment. Okay. And of course, I had to see a doctor regarding my heart to make sure my heart is strong enough to go through the procedure. I have to see a doctor regarding my lungs to make sure my lungs are healthy enough to make sure to be operated on. And also, I needed medical clearance from my primary care physician. And because if you do not have clearance from your primary care physician, guess what? You're not going to have the procedure done. It is that simple, folks. And to be perfectly honest, that could be very, very scary. Okay. Which is why it's very important that you do your research. Okay. First of all, get a doctor that's knowledgeable regarding the procedure itself. The last thing you want is to have some intern or some student, open you up and do whatever. You need to have a trained physician that's done it many times. Okay. So you go through the preliminary work. You see a doctor regarding your heart. You see a doctor regarding your lungs, and then you see your primary care physician. Usually there is a class to orientate you regarding what's going to be like in preparation to this procedure, and then there is also what's going to be done while you're in the hospital. Now, granted, this video is about maybe 3-4 years old, of correction, maybe 5-6 years old. So there might be some changes, but generally, you're going to be in the hospital maybe 2 or 3 days, depending what is your health condition. Another thing you have to bear in mind is this. You need to get to the hospital 2 hours prior to the procedure. Why? Because there's a lot of activity has to be done before they can operate. Okay. One thing you're going to need to be prepared is this. They're going to ask you multiple times, what is your name? What is your date of birth? And why are you there? Okay. And you have to be prepared to accept that you're going to be asked the same question multiple times. Why are they doing this? They want to make sure that you fully understand while you're there, understand what needs, what's going to be done, and what have you. So you're going to see the doctor who's going to perform procedure. You're going to see the doctor that's going to give you anesthesia. Okay, then they're going to talk to you regarding what types of anesthesia, what have you. Believe me, you will want to ask questions. Okay, and of course, they're going to do everything possible to minimize the risk because there are risks. Okay, there's a risk of infection also with any procedure. Even there is a small risk that you can die. That's a reality, but I would say that's a very small possibility. But just be prepared. Anything these are risks that can occur. Okay, there's also the risk of infection. So obviously they're going to put you in a room where it's supposedly cold or what have you. Good evening, Don Armando. Thank you very much for stopping by. The topic for tonight is my knee replacement story. So I just shared a video regarding preparation for a knee replacement. Also, I want to let everybody know that the link to join the panel has been pinned. So if anyone wishes to join the panel, by all means, they can do so. And as I stated earlier, anyone, if they wish, they can share the stream because this is what I'm doing is providing information, particularly those who are thinking about getting a knee replacement done, whether it be partial or complete. Well, okay. We will see. Hopefully, okay. Hopefully, we'll see. Time will tell. Okay. So the procedure itself is anywhere from 90 minutes to 2 hours. Okay. And you will be asleep. Believe me, you will want to be asleep. Okay. The last thing that you want to see that you're fully awake when they open up your knee and do whatever the fluff they do. You do not want to see that. You're going to be scared crapless. Okay. So after they do the procedure, they take you to a room to recover, recover from the anesthesia. And then you will be, during that time that you're in the recovery room, you're going to be kept under extreme close observation. And then you're going to be taken from the recovery room into a room where you will spend the next day, 2 or 3. One thing that please bear in mind is this. If you have your procedure done in the morning, by the afternoon, you will be walking. Okay? You'll be walking with the assistance of a therapist, but you will be walking and you got to walk. Okay? And the reason why you have to walk is that you have to start moving that knee of yours. Okay? You have to bend it, and then they're going to train you how to navigate stairs. They're going to train you how to take a shower. They're going to train you how to get dressed. Okay, they're going to train you to do a lot of things, and depending what is your situation as far as your health, you may either get discharged home or you might go to a nursing home to do rehab. Okay. If possible, make sure that if you do live alone, if you can stay with someone to help you do some of the chores when it comes to like laundry and taking out the garbage. And again, If you have pets like a dog, make sure someone's looking up to your dog, because the last thing you want is to come home and then Fido gets all happy and starts jumping all over the place. And next thing you know it, Fido jumps on you, and then you fall on the floor, and then you could hurt yourself. And then you'll guess what? You may have to go back to the hospital. And believe me, you would not want that to happen. Okay. So some of you will be placed in a nursing home. Now, let me tell you something. My experience in a nursing home was not a good one, and I'm going to tell you why. So I go there. They gave me the 411, which is basically okay. Make sure that you do not go to the bathroom by yourself. Make sure that you don't get out of bed without any assistance. Okay. First of all, the first night, they removed the walker that was left for me to use. So basically, I was completely helpless. And then when I went to the bathroom, I had to go to the bathroom by myself because no one was available to assist me to get to my bed, which meant, guess what? I could have fallen and hurt myself. Because another thing you have to bear in mind, that during the time that you're in the hospital and during the time that you are in a rehab, you are considered a fall risk. What does that mean? That means being that your knee is weak, okay, because you've been operated on, you can slip and fall and hurt yourself. And guess what? If you hurt yourself, you can fracture yourself. You can fracture a bone, you can fracture your knee, you can do some serious damage if you're not careful. So that was the first terrible thing that they did. Another thing that they did at the nursing home, which was called the Jewish home, they gave me another patient's lunch. Yes, they gave me another patient's lunch. It's like they couldn't tell who's who. Okay. And the problem is with nursing homes is they are understaffed. Good evening, Irby. Thank you very much for stopping by. The topic for tonight is my knee replacement story. So I'm just sharing with everybody here the situation regarding how I had to get a knee replacement from my left knee and my right knee. So right now, I'm just telling you about what happened to me when I was in a nursing home. Okay. Now, my mother, God rest her soul, was alive, and she went to visit me. However, my mother had brought snacks for me. Now, the fact of the matter is, the other patients were being neglected. So, out of the goodness of my mother's heart, the snacks that were supposed to be given to me ended up going to some of the other patients. Okay. And then on the day I was discharged, some ass clown, maintenance person, cleanup person, whatever the fuck they were, pushed me and almost knocked me down to the floor. And I could have hurt myself real bad. And when I told the facility regarding the issue, they was not taking it seriously. So what I ended up doing, I ended up calling the NYPD to come in to complain. That experience has affected me so much that when I had my right knee done, I did not want to go to a nursing home for rehab. Okay. Now, when you're discharged, you will be given an appointment for follow-up 2 weeks after the procedure to see how the knee is. Also, you will undergo physical therapy. Now, in the case of my left knee, I actually had someone for visiting nurse services come over to check my wound. I also had an occupational therapist to help me to walk safely and do my chores safely around the home. And I also had a physical therapist come 3 times a week to bend the knee and bend the knee and bend it, and it hurt like the dickens. Okay. In fact, I was yelling and screaming so bad, my mother thought I was being tortured. I okay. So I went to undergo therapy for several weeks. Now, one thing to bear in mind: when you go home, you're going to be using a walker, okay? Because your knee needs time to get strengthened, and a walker will help you need to get stronger. Now, in time, um, you will be able to move from the. Okay, I appreciate. I'll text you. Now I tried to set an appointment for the procedure. I'm gonna have to wait a few days. So at one point they were talking about early October to get the knee done, which means I may not be able to attend delegate training, which will be done in late October. But I will let you. I will let you know. And in fact, also I'm going to keep Denise Gonzalez informed as well because she asked me to keep her in the loop regarding my current situation. As a first of all, let me just state that I really appreciate all the love and concern that all of you has expressed uh, regarding my health. Okay, I'll tell you this much: I will be operating on Mount Sinai Hospital. Okay, which one at this point I don't know. Okay, I would know more about it once we schedule a date for the procedure itself. So getting back to my story. So for the first I would say about 4 weeks, you're gonna be on a walker, okay? And then the therapist will monitor you, and the therapist will let you know when you are able to go from being using a walker to using a cane, okay? And you cannot be embarrassed. You need to use the cane. Now, there's certain equipment that you're going to need um, once you get discharged to your home. First of all, you're going to need a bathroom bench. Okay, what is it? Basically, it's a bench where it's put in the bathtub so you can sit down and um, take a shower safely. That's the one thing that definitely you're going to need that. You're going to get a thing called a reacher. What is a reacher? What it is something that you use to grab. Like if you drop something, you can just grab it and pick it up, whether it be a phone, whether it be a shoe, or whatever. You're also going to get a sock help. What it is a device to help you to pull out your socks. Okay. Also, the occupational therapist or the physical therapist is going to teach you how to dress properly. Also teach you how to get into your bed properly. Okay. Um, let me just let me warn you that for the first several weeks, you're going to be sleeping on your back because you will not want to sleep on your stomach or on your side, particularly if you're lying on top of the knee that's been operated. You will not want to do that. It's gonna hurt like the dickens. Okay. So also another thing I'm looking into is accessoride. Okay. And what is that? Well, it's a form of transportation for those individuals who have a disability are not able to navigate the subway or the buses. Okay. So I'm definitely going to be looking to accessorize, and I have hesitated because I have heard too many bloody horror stories regarding accessorized people waiting hours and hours and hours in the ride never showed up. So we will see how that transpires. So, as I stated before, you will prepare your home. Um, you will do the exercises every day. You'll go to therapy several times a week. Okay, and you're gonna be away from your job. Okay, how long it'll be? Okay, it all depends. Okay, if you're talking about an office job where you don't have to do much heavy lifting or anything like that, you're going to be out possibly 8 weeks. If you got a more physically taxing job, you're talking about 12 weeks or at least. Okay. And that's something you have to bear in mind. So for the time that you're out, your job is going to be to work on that knee to get to the point when you're able to function relatively normal. Okay. Now, there's certain things that you're not going to be able to do on your knee. Okay. Running is a no-no. You're not going to be able to run because what happens when you run, you increase the wear and tear of your knee. Meaning, guess what? You're going to have to go and get another revised knee replacement surgery. And I never thought I would have to go through it once, and I don't want to go through it more than once. So running is out of the question. Hockey is out of the question, particularly for impact hockey. Nearing that's going to be a problem. Okay, if you any gardening, make sure that you get yourself a stool so you can sit down. Okay, let's see what else. And of course, there's going to be swelling. Okay, but it, but they're going to explain to you how to keep the swelling down, which means you're going to be spending a good deal of time um, icing that knee, and I mean it, a good time. Also, you're going to be on pain medication. Let's keep that real. You're going to be on pain medication, okay? Because it's very important that you take your pain medication, okay? If you don't take your pain medication, guess what? You're not going to be able to do the exercises. If you do the exercise, guess what? Your knee gets stiffened, and it gets, and then what's the consequences? You're going to have another procedure done in order to fix the problem. Okay. So it's very important that you do your exercises every day, possibly 3 times a day. Okay. And also what you're going to be doing is you're going to be increasing the range of your new knee. So it's very important. It's very important that you do your exercises every single day, several times a day. Okay. Now, I was fortunate in the sense that first of all, I properly planned for both knee replacement surgeries. First of all, I had enough time saved up, so therefore I was able to stay on payroll, meaning I got paid while I was out, which is something that's very important because the last thing you want to be worrying about is not paying your bills while you are recovering. Okay. Also, I was smart to get short-term disability. Okay. Okay. Now, let's keep it real. You're not gonna get rich off of that. But what it did do is provide like a little additional money. Excuse me. Excuse me. So that I was able to get short-term disability for their help. Now, depending on what is your employer, you might be eligible for short-term disability. Look within your HR department regarding that issue. Okay. Now, as I stated, when I had my left knee done, I was out for 3.5 months. When I had my right knee done, I was out for 2.5 months. Okay. And of course, what that meant was there's certain activities like Christmas holiday, like office parties for my job, I could not participate in because I was on medical leave. So, the last thing they want is people on a medical leave coming to the office on a regular basis because if God forbid they hurt themselves, they're not covered. So, let's just get something to drink. Okay. So, if you follow the doctor's advice, follow the doctor's instructions, and you do everything that you need to do when it comes to preparation for knee replacement, and what have you, you will have a more successful outcome. What I'm going to do is just give me a moment. I'm going to show. So what I'm going to do is I'm going to show one more video regarding what to do once you're home on a knee replacement. So it's the same video once talking with dogs. So what I'm going to do is I'm going to share it, okay? And again, free use. If anyone wants to join the panel, by all means, the link has been pinned. If anyone has any questions, by all means, they can put in the chat. If there's no questions or whatever, we will wrap this up. So what I'm going to do is I'm going to share my screen.
And I'm Dr. Brad Wiening.
Thanks for joining us today. Today's topic is what to expect after your knee replacement. So you've had knee replacement surgery, you've gone home. What does the landscape look like for me now that I'm home?
Okay. I think the first thing to talk about when we talk about this is where do you go? So the hospital, you're at the front door.
Yeah.
Someone's got to come get you.
Yeah. Fair enough. You're not going to be driving yourself home.
Can't drive home.
You'll need help with this. So somehow you've got to get yourself home. And are you going to go home for sure?
So not necessarily. And we have some other videos that not only go through what happens when you're in the hospital for a knee replacement, but also things that you should prepare for before. And one of the key ones that we've both talked about is you need to have a plan. So I would say the options for going home are, one, to go to your own home.
Yep.
1, to go to a friend or a family member's home.
Yeah.
3 would be to potentially go to like a convalescent care, almost like a temporary nursing home.
Yeah.
And then the last one would be the inpatient rehab. I think people can't really bank on that just because of the minimal resources that are available.
Right. And where you end up kind of depends on the big picture. How mobile are you? And we can predict this pretty well before your surgery. When you go to your pre-op visit at the hospital, they will be able to help you determine by asking you some questions and seeing what your living arrangements are like. They will be able to help you determine if you're going to be able to go home alone after, or if you're going to need to have a friend or family member stay with you, or if you're going to have to stay in a rehab center or a convalescent care center. But for sure, the vast majority of the time, you're going home.
Yeah, and every situation is different, so certainly discuss this with your family doctor, with your surgeon, and be prepared.
Okay, so you get home now. Am I going to be able to walk around the house?
So typically, when our patients leave the hospital, one of their criteria for discharge is that they have to be able to mobilize safely, usually with a walker, and to be able to go up and down some stairs. So yeah, you are going to be independent. You're not going to be fast. You're not going to want to do 50 flights of stairs, but you are going to be getting around pretty well.
And am I going to be having a lot of pain when I go home?
So, yes, after knee replacement, you're going to be sore. It is a very manageable pain. It's going to require a bunch of different things, but yes, you're definitely going to be in pain. What do you tell people as far as the pain goes, Paul? How can you control it?
I say it's
Okay, it is something to bear in mind is that once you get discharged home, you're gonna experience some level of pain. Okay. However, they're gonna teach you how to deal with it with medication and with other means to limit the pain. Now we will continue. And again, fair use, fair use, fair use.
it's like training for a marathon. An athlete training for a marathon experiences pain, but it's necessary to enhance his performance. So same for you. When you get home and you're with your knee and it's sore, you're going to be taking medications to help manage the pain. That's going to make it manageable. And even if you make the pain manageable, when you go to your physiotherapy, which is crucial, when you go to your physiotherapy, you're going to experience discomfort.
I totally agree. And that's why I have so many patients who come to me and say, hey, I didn't even use all the pain pills you gave me. And I go, because I want them to take their pain pills, because if they're not taking their pills, their pain's not controlled, so that they can't push themselves at physio. A lot of people are nervous about getting addicted to narcotics, which certainly I respect and acknowledge that potentially is a problem. However, in the setting of acute postoperative pain, I'd much rather have you take the pills and control your pain so that you can really push hard, like Paul said, like a marathon. Just give it everything that you have every single session so that you can get a better permanent outcome.
So that's pretty well the most important thing for you when you get home is to attend a physiotherapy clinic. And some people ask about having a physiotherapist come to the house. I'm not a big fan of that because at your house you don't have the necessary equipment, and the kind of physiotherapy you get at your house is variable. Whereas if you go to a clinic and find a clinic or the hospital or somewhere where they have treated a lot of people successfully with knee replacement, they have experience in that area. If you go to that center, I think you will have a better outcome.
And we had talked in our what to expect before knee replacement video.
Okay, now I'm going to give you my opinion about it, because when I had my left knee done, the therapist went to my home. Okay. When I had my right knee done, I actually went to an outpatient clinic. How I'm going to deal with that, I don't know, because I am not living in Manhattan. I'm living in Parkchester. So for me to come all the way down to Lower Manhattan for physical therapy, that's going to be a challenge. Okay. It might be easier if I have like accessory or some sort of paratransit, but that's something that I will need to discuss with the doctor. Okay. In any case, we will continue again. Fair use, fair use, fair use.
Setting this up ahead of time, maybe doing some prehab so that you know some of the exercises already, and maybe have already even met your therapist, and maybe even we're so forward thinking that you may have even booked your first session before you had your
I
surgery.
think that's great. And I wouldn't mind if you became obsessed with your knee range of motion, actually. If you just thought, oh yeah, all I got to do is get this knee moving, range of motion of the knee, and become obsessed with it so that you're really focused on trying to improve that after your knee replacement.
I tell people that's their job because they say, when can I go back to work? I say, you can't. Your job is your knee. That's the only thing you should care about.
Right.
8 hours a day. I want you just to move it, move it, move it, move it. I think there's a song. Yes, a song. Yeah. What about swelling, Paul?
Yeah, there is going to be swelling. You're going to experience swelling. And how long will that last? It can be variable. It can last for several weeks. It can last for several months. It can last for 2 years.
Yeah. And not only just in the knee, sometimes the whole leg.
Yeah, the whole leg can swell up. So some people say, well, when can I go back to work? You mentioned work a few minutes ago.
Oh, I wasn't done swelling yet.
You're still going to swell?
Yeah, I'm still going to swell. So what I was going to say is ways to control that are with ice or a cooling unit that we talked about. Potentially even a compression stocking. Some people use over-the-counter or prescription compression stockings because controlling your swelling is really helpful to improve your range of motion.
Absolutely.
Now my swelling's under control.
Can I go back to work?
Can I go back to work? So what do you tell people? How long? How long to go back to work?
It's variable. Okay, so it depends what your job is.
Yeah.
How much you like your job.
Yes.
And if
someone's going to pay you to not be working.
So if you have a plan where you can get paid to not be working to recover, I find people will use that time. Whereas if you're the type of person who is self-employed and your livelihood depends on you showing up for work, you will find a way to work from home or something.
Yes.
In general, very broad terms, I would say 6 to 12 weeks.
That's what I tell them too. I think that's reasonable. And the 6 weeks, probably the lower limit, is because I tell my patients they can't drive for the first 6 weeks.
Yeah, I'm the same. Don't drive for 6 weeks because your reaction time may not be as good. You will still be on some heavy-duty painkillers.
What if it's my left leg?
Still, even if it's your left leg and you're driving an automatic car, you're still going to be on some form of narcotic, probably for pain control. So it's not safe to drive. You're going to be distracted by the discomfort in your knee.
Yeah. So that's a guideline. Discuss it with your surgeon.
Yeah.
Surgeons are different, but certainly that I agree with you. 6 weeks is my standard answer.
Now, bear in mind that this video was made 7 years ago, so it might have been changed somewhat. The doctor is telling me that I'm going to be out for 8 weeks. Okay. Now, one thing that works in my favor is that I have an office job, so therefore it's no heavy lifting or anything like that. I can stay seated for a good portion of time, and I'm sitting behind the computer. Okay. So, and the way that I'm set up, the printer that I use to print out my papers is right across from me, so I don't have to walk a great deal. So now we will continue, and again, fair use, fair use, fair use.
Travel. I get asked that question. When can I go to Florida? When can I go to the cottage? When can I travel?
So that brings up a good point. One of the other things that I'm really worried about after surgery or concerned about is blood clots.
Right.
With any lower extremity surgery, there's a risk of a blood clot. So people are going to be going home on anticoagulation. Typically, I send my patients home on an oral anticoagulant. That's 2 weeks. And then after that, they still may have a risk of a blood clot. So on a side note, please beware if you have increasing amounts of calf pain, chest pain, or shortness of breath, you should see your doctor or go to the emergency room because that could be a sign of a blood clot or a blood clot that has moved. And then back to the travel.
That's what we worry about with travel. We worry about you sitting on a plane or in a car for a long period of time, immobilized.
Yep.
And that's what increases your risk of a blood clot.
Do you give them a ballpark date? Like how long?
You know what? I'll be honest. I used to say 3 months
Yeah.
before you go like on a flight, but I think people are mobilizing a lot faster nowadays, and people are generally, it's on a case-by-case basis. If someone is moving pretty well and they feel good, I'll let them travel at six weeks to 2 months.
I say 6 weeks for my knees. I tell my hips 3 months, and you can
Yeah.
talk about our hip replacement video later because there's some specific issues related to the hip. So yeah, I think 6 to 12 weeks is probably not unreasonable.
Okay. And now
See, now what they're discussing is a very important point, because if you're talking about a flight, depending on where you're flying, you're talking about anywhere from an hour to 2 hours, 3 hours, depending. Okay. Definitely, if you're talking about flying to the other side of the country, you're talking about at least a good 3 or 4 hour flight, or whether you talk about going to the Caribbean. So just bear in mind that you're sitting in a seated position for extended periods of time. So what they recommend is, 6 to 12 weeks. Of course, it's by a case-by-case basis. Because remember, not everyone's the same physically. So now we will continue again. Fair use, fair use, fair use.
blood clots are one thing you got to watch out for when
Yep.
you get home. What else do you have to watch out for as an indication that, hey, something might be going wrong here?
I think infection is probably the number one, and people say, well, how am I going to know if I have an infection in my knee? What do you tell them?
Well, it's impossible to know with 100% certainty just by looking at the knee. But generally, if you're getting better, let's say, do you feel better this week than you did last week, and last week than you did the week before? If you're getting better, especially in those early first few weeks, then you're unlikely experiencing an infection. And an infection would give you pain that is getting worse. The other sign of infection would be redness and swelling. But guess what? After a knee replacement, your knee is red and swollen. So if your knee is generally looking better, the redness is getting better, the swelling's getting better, then there's not likely an infection. But if things are getting worse, then there might be an infection.
Or if the wound's starting to pull apart, or heaven forbid if there's pus. Thankfully, the early infections are pretty uncommon. So at a week, the odds of having a deep infection in your knee seem to be actually quite low, but sometimes it will show up a little bit later. But like Paul said, deteriorating function certainly is a big concern, which I think brings me to another point. How do you know if you're doing okay as far as range of motion? My patients say, hey, I was told by my physiotherapist I have 80% range of motion.
Yeah. The way we like to measure range is in degrees.
Yes, not percent.
Yeah, not percent. So we think about your knee straight out, it's at 0 degrees, and when you bend it like you're sitting in a chair, that's about 90 degrees. And we aim for more than 90 degrees. We'd like you to have more than 90 degrees, and we'd like you to get out straight to as close to 0 degrees as you can.
Yep.
So definitely work with your physiotherapist to get that range going. So we've talked about a blood clot, something that can go wrong, infection, something that could be going wrong, developing some stiffness that you can't get through, could be a sign something's going wrong. And then there's the other sort of general health things that can go wrong after a knee replacement, but that can happen anytime. If you're getting chest pain, shortness of breath, any worrisome symptoms like that, you should get back to an emergency room or your doctor as soon as possible.
Now, what is stating, okay, if you're experiencing any chest pains, or you're experiencing any, like a blood clot or anything like that, see your doctor ASAP, okay? Because if you have a blood clot, it can extend to other parts of the body, and it could be a serious health crisis, okay? The swelling, it's going to be there, but you're going to learn how to reduce the swelling, okay? And the key is movement. The more you move that new knee, the better it will be for you in the long run. So now we will continue. Fair use.
Those are all good points.
Okay, so we've got you home, we've got you doing some physio, we've got you when you're going to drive, when you're going to travel, when you're going to go back to work.
Sports. What about sports?
Yeah. Sports after. That's a good question. First of all, what kind of sports can you do with your knee replacement? We've discussed this before, and we've talked about knee replacement in our other videos.
I tell people to try to avoid repetitive, high-impact stuff, but otherwise they can do most things with the understanding that they have an artificial knee that's made out of metal and plastic. So you probably have to kind of back it up just a little bit from what you're doing before.
Yeah. And what about golf? That's a common. When can I go?
I love playing golf.
I do too.
Yeah. So I tell them 3 months.
3 months for golf?
Yeah. I say if you want to start sooner, I'd tell you to work on your chipping and putting, which is where all the money is anyway, inside of 125 yards.
Good point. Yeah, I'm the same. It's about 3 months, but you can start putting, start chipping a little earlier. And I'll say when you get back into it, if you have a shot where you normally would use 7-iron, maybe ease up and take a lighter swing with a 5-iron.
Really? You give them that kind of advice?
I go right in there.
Okay, I like that.
Yeah.
I will also tell them maybe they should consider taking a cart, or maybe taking a cart for the back 9 if they feel like walking might be too much.
I always take a cart. Just the way.
Golf is an exercise, so don't try to trick yourself into thinking that it is.
I've only got a splendid time. I want to have fun.
I like it.
Okay, so can you think of anything else?
No.
After any other types of questions we usually get? I got a good one. When can I have the other side done?
So some people do them both at the same time. That's not something that I do, but certainly lots of centers do that. We've talked about it in other videos why we feel that maybe that's not best for us. But what I do tell people is my standard answer is 3 months, mostly to allow you to recover your blood count, have the wound healed, avoiding acute complications, and forget how much it hurt.
That's right. Okay, so that's pretty well what you can expect when you get home from your knee replacement.
If you have any other questions about other topics that
So I like these doctors because basically they explain everything in a way that it's not in doctor lingo. I mean, basically it's understood by many people, particularly those who has not pursued a collegiate level of education or don't have a knowledge when it comes to medical terms. So let me just give you my take, okay? And I think after that, if no one else makes a comment or no one else joins the panel, then I'll start to wrap it up. When it comes to having a knee replacement, okay, first of all, you're not replacing the entire knee. What you're doing is you're replacing the damaged portion of your knee. Okay. So there are many things that you have to take into consideration. Okay. Why? Also, you need to have reasonable expectations as far as your recovery. Okay. The key word, if you follow the doctor's instructions, okay, you will be able to get the mobility that you lost because your knee became arthritic. Okay. Of course, with every procedure, there's always risk. There's risk of infections, there's risk of blood clots, there's also a small risk of death. Okay. However, the key is the following. Make sure that you follow all the instructions. Okay. Make sure that you do your exercises every single day. Make sure that you take your pain meds every single day. Okay. And you have to take it in the prescribed manner that they say. If they say to you, take your pain medication 3 times a day with food, guess what? You need to take it 3 times a day with food. Okay. And have some sort of a strategy as far as what's gonna be your living condition to make sure that your home is as safe as possible, without any clutter, without any rugs to trip you. Just make sure that the rugs doesn't trip you because you can fall and hurt yourself. So that being said, now let me discuss with you regarding um, Thursday's stream. On Thursday's stream, I'm going to be discussing with you regarding what are some of the common mistakes people make regarding having a knee replacement. It could be maybe they did not take their pain meds. Maybe it could be that they did not have reasonable expectations as it pertaining to a knee replacement. Um, it could be the lack of physical exercise because there is the temptation that not to move that knee because it will hurt. And that's something that we all have to wrap our heads around. The knee is going to hurt. It, of course, it's going to hurt because you undergone major procedure. So, of course, the knee is going to be sore. But the key is this: you got to move that knee every single day. If you don't, it'll get stiff, and next thing you know, you're going to have another operation to unstiff the knee. You do, then trust me, you do not want that. So it is in your well being, in your best interest, that you take your pain meds. Make sure you get your 3 meals a day. Make sure that you do the exercises. Make sure that you attend physical therapy. If there's any health concerns, make sure you let your doctor know about it ASAP. Okay. And you will recover. You will recover. Okay. And it could be an humbling experience if you're the type of person that you're used to doing things for yourself and then you have to have other people to help you and things of that nature. So that can be a humbling experience. Okay. But you know what? You're gonna have to put your pride aside, accept the help that you need. Okay. The only good thing, or if you can call it a good thing, because of my knee, is that sometimes, and I repeat, sometimes, people will let me have a seat on the subway. Okay. When I get on the bus, people will sometimes let me go ahead of up to the top of the line, front of the line. Okay. Um, with me, it's not an issue. If I have to wait at the end of the line, I have to wait at the end of the line. It is not the nature of things because unfortunately, some people get um, lose their cookies for any little thing. So, with that being said, and again, I encourage those who are the YouTube creators, if they wish, they can share the stream. Okay. And hopefully, my discussion has been of some use. Hopefully, it will give you some insight in regards to what is to be done in order to prepare for knee replacement surgery. And basically, it's going to be the same whether it's a a partial knee replacement or a complete knee replacement. And again, it's a misnomer because you're not replacing the whole knee. What you're doing is replacing that portion of the knee that is infected. You're replacing that portion of the knee that is damaged. Okay. So, first of all, I just want to thank Irby, Don Armando, and Keisha uh, for being in the chat. Okay. I also want to thank all those who are watching in the clouds. Just make sure to please like, subscribe, and hit the bell notification to all So therefore, whenever, and I see here we have a guest, so we're gonna bring him on. Good evening, Joaquin.
Hey, good evening. Shout out to my YouTube dad, Jose Negron. Just saw that you was on right now. Just calling to wish you a speedy recovery, and
Thank you.
you're gonna be just fine. We all
Mhm.
go through trials and tribulations in life. This is one trial and tribulation that you'll get through.
Yeah, I truly believe that. I decided to share my story with others because there are other people who are undergoing the same thing I'm going through right now. So hopefully, by me sharing my own personal story, it will be a form of encouragement for others.
Yes, absolutely, absolutely.
So the Thursday, what I'm going to be doing is I'm going to be sharing some common mistakes people make regarding a knee replacement. One thing I don't know if you noticed, I actually got a new laptop.
No, I didn't. I didn't notice that. No, I didn't. But that's great. That's great, man. That's good. That's good to hear.
Yeah, because I will tell you something. Those those streams where the delay was like, oh my goodness. It's like it's comical when you think about it, but not at the time.
Yeah, yeah, it happens. It happens. So it
So
happens.
yeah.
Now you got something a little bit better. Maybe it might have been an internet connection. There's no telling. Or it could have been a laptop, but now you got something better. So that's great.
Yeah. And I was actually able to share videos, something I couldn't do.
Oh, okay. All right.
So
Ain't nothing wrong with that.
so what I did was this is YouTube channel called Talking with Docs. So you have two actual doctors. So there was a sharing their own expertise regarding what to do prior to having a total knee replacement, and then what you do when you discharge. So I felt that um, to have trained medical staff to uh, share with the audience. So it's not just me making all of it up, even though we know like that's not the case. But this is actually things that you have to consider.
Right.
So, have you known anyone that have gone through a total knee replacement?
Not that I know of. At least I don't think I do. Um, I've heard of people actually having knee replacements done, but I don't think I know anybody personally. I think I know some people that had to get hip replacements and stuff. Well, not hip replacements, but rods put into their hips to um, make it where they can heal properly.
And of course, wife was in the chat earlier.
Oh man, shout out to my YouTube wife, Kashel. Shout out to Kashel. Yeah, so
So yesterday they did a CAT scan, so I'm just waiting for the doctor to explain to me what they found. And at this point, I'm just waiting for the scheduled date for the procedure. So according to the doctor, I'll be out of work for 8 weeks.
oh wow, okay.
Yeah. So what depending how things go during my recovery, I might be doing rebroadcast. It's all. I just got to take things day by day. Right now,
Right,
my priority is make sure that I do what I need to do to get better.
right. Because this is
Mhm.
something that has to be done. So it's always the first step that's the most difficult. And then after you've passed that difficult stage of the first step, then you can focus on taking one step at a time. And it gets better as time progresses.
True. I'm sure my audience is aware of your channel, but for the benefit of those who who may not know anything about your YouTube channel, would you like to share a little bit about your platform?
Oh, well, I just got a Reeky Dink platform, guys. It's just a platform where it can, we can go, we can chill, we can speak about racial issues, we can discuss certain things, we can have a good time, we can discuss um, you know, throwback music, fashion, different things like that. Discuss media, what's going on in the world, various topics, but for the most part, since we've had, discussed a lot of the serious issues, I try to keep it light for a place where everyone is welcome to come over and voice their opinion on certain things. And, we all have a good time and, enjoy my platform. It's nothing fancy. I don't have the great background artwork. I barely know how to work a lot of things on StreamYard, but it's kind of just like one of those get together channels. It's a rinky dink channel, but everyone's more than welcome to come over and, chill with the kid. And, we build, I pick your brain and you pick mine.
Well, look, in all fairness, my platform is not exactly all that high tech. I mean, it's just that, like I said, I have dealt with my share of equipment issues. I have dealt with my share of Wi-Fi issues. So, but the show must go on.
Absolutely. Absolutely.
But what I can tell you is, there's a way that you can pin the link. So what I do is, like, when I'll schedule the stream, what I'll do is I'll put the link in the chat, and then with another device, I go over it, and then there's three dots, and then one of the dots allows you to pin the link. So therefore, you don't have to keep putting the link in the chat all the time.
Okay, I'm gonna definitely keep that in mind because I need to definitely have my links pinned. So definitely, I'm gonna keep that in mind.
But lately it's been very quiet as far as a lot of the YouTube creators that we have known. Okay, of course, we haven't seen anything too much from Radical Latino. We saw like one or two videos from Gigi, one or two videos from Multi, and of course our friend Ramon has been busy, in his travels. So hopefully, in the near future, he will produce some content for all us to enjoy.
Absolutely, absolutely. Everybody's been busy with life, you know. Now that we've been acquainted with each other for years on YouTube, everybody will be making a comeback shortly. I just think, got to make sure that um, everything is taken care of outside of social media so you can deliver a better show when you come back.
Yeah, definitely. One thing, when it comes to social media, I mean, you have to take it with a grain of salt, because certain people like to project like a false image on certain people, and sometimes people are only led on what they see on social media and not take the time to know people on an individual basis.
Absolutely, absolutely. So, it is what it is, man. It's a multitude of personalities on social media. You know, um, a lot of different characteristics that certain people have that, other people may not be quite, privy to, or just wanting to, kind of be around. Everybody got their own different ways of, how they conduct themselves when we're in this virtual world of ours. So, that's part of it.
Yeah, and one thing you have to bear in mind, that YouTube creator has the right to govern their platforms as they see fit. I mean, you have some great YouTube creators, and then you have some that unfortunately are not as great. I mean, that is the reality. I mean, look, I there are literally millions of YouTube creators out in these YouTube streets. So basically, whatever it is that you're looking for, you can more or less find someone to follow.
Absolutely. I wanted to say shout out to Irby. What's going on with you, Irby? How you doing today, brother? Hope all is well.
Yeah, I hope. Yeah,
Uh,
I hope. I hope you're doing well, Irby. Um, I will say this much. I mean, I have been blessed to have you know, a huge support base of people who've been there to support my content. People like yourself, Keisha, Irby, um, Don Armando, and the other people that have supported our platforms. It's that look, we're not big YouTube creators by any stretch of the imagination. With us, I believe it's a labor of love.
Absolutely. Absolutely. We've been around for a while. We've known each other for a while online. So it's all about love and support. Absolutely.
Uh-huh.
So, and I just had to come up here and show mine for a few minutes.
I appreciate it. I appreciate it very much. And like I said, the whole purpose of this is to, hopefully for those who are going through the same situation I'm going through right now, that would be a sense of encouragement.
Absolutely. Absolutely. Like I said in the beginning, when I first arrived on your stream, you're going to get through this, Jose. You have a lot of support, a lot of people that care. The first step is the hardest. Once that step is out the way, you can focus on a speedy recovery. And before you
Mhm.
know it, you'll be back better than ever. There'll be one less problem that's been resolved.
Yeah. I mean, at this point, I made it a point, you know what? Um, I'm not going to get involved in the clownery. If people want to act stupid, that's fine. I'm not going to engage because I got more important things on my mind. And right now, my priority is make sure that I get healthy again.
Right. Absolutely. Absolutely. That's part of YouTube, man. Sometimes it's entertainment. I mean, sometimes it's entertaining. Sometimes it's a little immature, but that's part of YouTube. That's how certain people decide that that's how they roll. That's how they roll. So
Yeah.
that's not important. The only thing that's important at this particular point is your speedy recovery.
Okay. Well, I appreciate you stopping by.
No problem. No problem. Shout out to you once again, and shout out to everybody in the chat. And that's all I gotta say. I gotta get ready to get out of here. I gotta go take care of some things.
All
So I
right.
just want to stop by and show some support.
Appreciate it. Just be safe out there.
I definitely will. I definitely will. All right, Jose. Talk to you later.
Take care. Thank you very much. So, what I'm going to do is I'm going to stop to wrap it up and give you my final thoughts. Whenever anyone is thinking about any type of major procedure, and a knee replacement is major procedure, there's going to be concerns, there's going to be fears, there's going to be worries. The key is to educate yourself as far as what you need to do in order to get better, to get the most favorable, healthy results possible. Okay. As long as you have that mindset, as long as you're focused on that, you will be fine. So I appreciate Rakeem stopping by. I appreciate everyone being in the chat. So what I'm going to do is I'm going to wrap this up. I'm going to be doing another stream on Thursday. It's kind of like a part two. But what I'm going to be discussing is some of the mistakes people make when it comes to a knee replacement. and people have made some of these mistakes. I have been fortunate. I have not made too many of these mistakes, but it's a learning experience. Okay. So, and again, of course, by all means, everyone is welcome to comment after the stream is over. Just keep it respectable. And of course, like I said, this stream and the stream that follows on Thursday, everyone is more than welcome to share. The whole purpose is that to try to encourage as many people as possible who are possibly thinking about getting a total knee replacement. Okay. And let me just quote the words of FDR. The only thing to fear is fear itself, fear of the unknown. Once you are armed with the knowledge, you are able to overcome anything. So, huge shout out to everyone that appeared in the chat. Huge shout out to Joaquin. Huge shout out to all those who are watching in the clouds. So, I'm going to close by stating the following. We must do everything possible to minimize our content with the mentally and intellectually challenged, because if we fail to do so, we will be infected by their stupidity and massive insanity. This has been another episode of Uncommon Sense with Jose Negron, and I thank you very much for your time and your attention. Take care and peace.
Strong.